Aloha! All right, I'm Jennifer Gutowski. I'm the Director for VA Pacific Islands Healthcare System. Been here and honored to be the Director for 2 years now, with the VA for 20. Thank you.
Okay, we were all back, thank you so much. We were all back in the green room and we tried flipping a coin, and that would work if we had 2 people, but with 4 we had to arm wrestle, and Jennifer won, so she gets to go. She gets to go first. So if you would, ma'am, we know there's a tremendous amount going on out there with the VA. We've seen about the Mission Act. Would you mind taking some time to share with us what you've got?
Absolutely, Dr. Brown. Thank you so much for this opportunity to be able to share with all of you all of the wonderful things that the VA is doing at the national level, and then I'm going to bring it down local to what's happening here in Hawaii and the Pacific Islands. The VA overall, we have a table in the other room, and I just want to mention for those that may not be receiving their health care from the VA or benefits, there's this wonderful booklet that's called Hello, Welcome to VA, Let's Get Started. If you haven't seen this booklet, stop by our table, pick one up. If you don't need it, share it with a friend. It has some wonderful resources that leads people through the process of what they need to be prepared to bring to get benefits, to sign up for health care, to sign up for educational benefits. So this is really a wonderful booklet. All the numbers that you would need for VA are right here, and a wonderful tool. So please help me spread the word about the Welcome Kit. I'd like to cover a little bit about the Mission Act, because that's truly huge for VA and very transformational in what's happening. Now, the Mission Act stands for maintaining internal systems and strengthening integrated outside networks. Got to have a good acronym. But there are over 50 elements to this law that have gone into effect, and many of them are still evolving in how those will unfold for our veterans. A couple that I will highlight today, one in particular, is care in the community and how that's changing. The Choice Program, as we knew it, has sunsetted effective June 5th. Now, all of our care in the community programs are under one umbrella. So what does that mean for our veterans here at Pacific Islands? Good news is the eligibility remains the same because we are a VA facility without our own VA full-service hospital. All of our veterans for VA Pacific Islands healthcare system are eligible for care in the community. So nothing has changed. What has changed is the partnership that we have with Tri-West. And in the past, for the Choice Program, veterans had the opportunity to call Tri-West directly for a choice appointment. Now, going forward, the VA is going to have more opportunity to do the care coordination. And we see this as a wonderful opportunity. We're going to have a chance to offer you care at the VA. And if we're not able to provide that, that's when we're going to turn things over to our partner at Tri-West, who will be able to connect you with that appointment in the community. So that's one of the major differences, and we see this as a great thing moving forward. One of the other new benefits as part of the Mission Act is urgent care. Veterans now have an urgent care benefit. How do you know if you're eligible for that? If you've received care from the VA in the past 24 months, you are eligible for that urgent care benefit. How do you find a retailer that provides that service? There is a website, and on our table we have a nice overview of a pamphlet that shows you where to find that information. The list of providers is being expanded upon day by day, and I'm certain Tri-West, Carl here will comment about that, but more and more urgent care locations are signing up. What's important for you to know when you do access that care is to be aware of your priority group, as well as be aware of how many times you use that benefit within a calendar year. I say that because there may be a co-payment of $30 associated with that, depending on your priority group, or as many times as you use it during the year. So that information is in the pamphlet that's at our booth, so please pick one up to learn more information about that urgent care benefit. Another big piece of the Mission Act is the Caregiver Support Program. And folks are asking, when is that going to be expanding to other veterans? To be honest with you, I don't have all those details yet. I'm still working on getting that information flowing from central office. But as soon as I know more information, I'll be sharing that with you. As far as I know, it'll be coming some point in phases during the next upcoming year. And again, more for follow on that. For those, just bringing it back to VA Pacific Islands healthcare system, for those, I don't, if I can see for show of hands, how many of you receive your healthcare from VA Pacific Islands? Wonderful. Well, thank you so much for choosing us. For those that may not be aware, we have part of VA Pacific Islands healthcare system. We have 11 sites of care throughout the Pacific. So we have a presence on all of the Hawaiian Islands, as well as a clinic in Guam, American Samoa, and the Northern Marianas. So we have a presence throughout all the Pacific. And not only do we just have a clinical presence, but we're also able to provide telemedicine. And in addition to that, we have a number of specialty care providers that we fondly refer to as circuit riders that ride the circuit from island to island to be able to provide specialty services to our veterans. So if you haven't signed up, please come see our booth. We'd love to provide care to you. We're very proud of the staff that we have on board. In fact, about 25% of our staff are veterans themselves. Any VA Pacific Islands healthcare staff in the audience? Woo! Really, really proud. We've grown our staff over the past 2 years. We've increased our overall FTE to about 1,400, about a net increase of 200 individuals to provide care, much needed care to veterans here in the Pacific, and we are very dedicated to that. I want to highlight some of the accomplishments and some of the services that we're now providing, because I'm really proud to be the director of the system, and it's really an honor for me to share with you all the good information. I want to share with you that during the Super Typhoon U2 out in Saipan, I want to let you know that VA Pacific Islands, our telehealth staff, were called upon under a FEMA task order to serve the people of Tinian to provide telemental health services as they were going through that very difficult time. I'm also very proud to say that over 1% of our veterans are now being seen from the comfort of their home, and we're expanding those services. We have veterans that can call a telephone advice nurse and be able to provide services. We also have the only VA all-virtual pain team in the nation. We also are working on increasing our HUD-VASH vouchers to help home our homeless. The homeless task force that we have in partnership with the community is tremendous. We have a coordinated entry system where we and the community are all working together to ensure that we're tracking our veterans that are going through the system. We've had very successful job fairs. So if you are a veteran or interested in working for the VA, again, we're hiring. So please come see our booth. We love to hire veterans. We also have very successful services. We've done a lot to improve our access to care. We've established what we call intermittent providers. We have additional teams that we've added. We've expanded clinical pharmacy. We also have our own, we're the only station we've funded a veterans mentor coordinator position. This is very important for the Veterans Treatment Court in keeping our veterans out of the jails. We're also very proud that we're rolling out customer service programs called Own the Moment, where we're focused on ease, effectiveness, and emotion of every interaction that we are having with our veterans, because it's so important that we continue to service. I'm getting the hint that I need to... No.
I just wanting you maybe to explain Own the Moment a little bit more. How is that being implemented and where?
Certainly. So Secretary Wilkie's #1 priority is customer service, and I'm a firm believer that if I have happy employees, I'm going to have happy patients, and it's really a training that really helps us focus on every interaction that we have an opportunity to connect with veterans and make it the best experience, because we want veterans to choose VA for their care, and we value opportunities and forums like this. It gives me a chance to hear what's working well and maybe what's not working so well that we need to continue to work on.
Right. Well, the theme was salute the service and fulfilling the promise. It sounds like you're implementing that already in your establishment.
Absolutely.
super.
Well, I'll just wrap up, and I know I can't help myself. I'm just so excited about all the good things that are being done.
You can see the list of notes she had handwritten. She's really into this.
I'm just again really proud of our staff, and I know that from a private sector standpoint, you know, they're comparing VAs now to the private sector and commercial, and they are now having some of how we're doing with our outpatient metrics in terms of prevention of medicine. And if you look, you'll see that VA Healthcare Pacific Islands is often doing better than the community. Not to say that we don't appreciate our community partners, but we are trying very, very hard to do the very best that we can. And we appreciate our partners, Triple Army Medical Center, Guam Navy Health Center, and in our partnerships and sharing agreements, we all work very closely together to provide services. So thank you.